Hey everybody, it's low carb and keto nutrition specialist Amy Berger bringing you, as always, keto without the crazy. Before I get into today's topic, I just wanted to tell you about something that you might not be aware of, even though it is in the notes in all my videos. I know not all of you take the time to bother scrolling down through all the notes. I've done a couple of live videos lately that they seem like they've been pretty popular. If you like live Q&A videos, if you want to be able to have more of them, did you know that if you join me on Patreon, you can actually have a live Q&A chit-chat session once a week? Now, it's not an individual one-on-one thing, it's a group call, but it's once a week for an entire hour. And it is for the $10 a month subscription. So I know $10 a month is no small amount of change, but if you figure there's usually 4 weeks in a month, then the $10 divided between the 4 calls means that each call is $2.50. $2.50 for an hour to chat with me, ask questions, and there are other people on the call, so it's kind of a group chat, but you can get support, cheerleading, a kick in the butt if you need some motivation. So if you value that, and if you have a spare $10 laying around every month, check that out. It's patreon.com/2itnutrition, and you can see those options. And you don't have to join for a year. You can do month to month. So if you do it for a month or two and you don't like it, you can just quit immediately. So I just wanted to tell you about that because I have wanted to mention it in all the videos since, and I keep forgetting. This is the first time I remembered to do it. So if you want to be able to chat with me, and it's on Zoom, and you can have your video on or not, whatever you prefer. So if you don't want people to see you, you don't have to be seen. You can just be on audio, and you're welcome to not ask or anything or speak at all. You can just have your, audio on and just be listening. You're welcome to just sort of sit and observe. All right, moving on. Today's topic is pretty important, and it's something that I hardly see anybody talking about in the keto world or anywhere for that matter. And it's something called lipedema. It is a medical condition, so right here at the outset, everybody knows I'm not a doctor. None of this, nothing in any of my videos is medical advice or diagnosis or treatment or anything like that. Just information. So lipedema is a condition that if you have it, you probably already know you have it, but you might not know you have it, and I'll get to that in a minute. And if you've never heard of it, once I describe to you what it is, you will probably realize that somebody you know has it, or next time you're out and about in public, you will start to recognize it. You'll start to see people that you strongly suspect might have it. So what is lipedema? Now, I didn't write down notes, but I have a stack of scientific papers here that I might read you little bits from. Lipedema, Lipedema, lipedema. It is not the same as dyslipidemia or lipids. It's not the same as blood lipids like cholesterol, hyperlipidemia. It's not that. Lipedema, think of lipid like fats, edema like fluid and swelling. Lipedema is fluid and swelling, extra fluid and swelling in the fat tissue, in the lipid tissue. So it's basically an expansion or a fluid swelling, a growth of fat tissue. It is almost entirely exclusive to women. There are some very, very rare reports of men getting lipedema, but it's extremely rare. It's almost solely a condition in women. And lipedema, you can kind of recognize it by the bottom half of the body. If you see a woman who is, and forgive me, I'm going to use words and phrases that are just easy to use. I don't mean them to be offensive. So if I say a normal size or a normal weight, there's a woman who's relatively small or normal sized in the torso in her top half, but at the waist, very, very large hips, very, very large thighs, and or very, very large calves. So the whole lower body is completely disproportionate to her top half. That's lipedema is very much affecting the lower half of the body. It's actually called the gynoid fat distribution pattern. Gynoid meaning woman, like gynecology, as opposed to the android, like men, like androgens, like males. Like the android fat deposition is that sort of apple shape, the abdominal kind of obesity, whereas the gynoid is where women store fat, in the hips, in the buttocks, in the thighs, in the lower body. So that's the lipedema. And what also distinguishes, so lipedema has several features that distinguish it from regular obesity, from just being larger. And that's one of them, is that it's really localized to the lower body, although many women with lipedema also have the arms affected. The thing is, though, the arm might be affected, but it kind of stops at the wrist. The hands are normal and the feet are normal. So the hands and feet are spared, and you can even sometimes see it. It's almost like in babies, they call it a bracelet, like when there's baby fat and it's pudgy and there's like actually a fold of skin there. So some women with lipedema can have that at the wrist and the ankles, because that's where kind of that excess fat tissue stops, and then the hands and feet are not affected by the condition. So what else distinguishes the lipedema is that the fat is painful. It actually has a name. I want to say it's adiposo dolorosa, like dolor in Spanish, pain. It's called painful fat, although there's a different something called Decrum's disease or Derkham's disease. I never remember which. There's another adipose fat tissue disorder that's painful that also kind of goes by that name, but they used to call it the painful fat syndrome. So when you touch the lipedema fat, it's painful. It bruises easily, and it's also nodular, meaning when you squeeze the fat or you press on it, it's like granular. It's like there's little marbles in there or balls. It's not kind of just soft and, you can feel like there's little balls. It's nodular, like there's nodules in the lipedema fat. So like I said, you may start to see this when you're out and about. It's considered a rare condition, but we're starting to realize it's not as rare as we may have once thought. In the papers that I've read, they estimate that as much as 10 or 11% of women worldwide have this. 10%. One in 10 women out there have lipedema. And so you can kind of spot it. Now, not everyone that has larger hips and thighs has lipedema, but you can kind of start to speculate about it when, like I said, you see a woman with kind of a smaller torso and a very, very disproportionate lower half. And this fat also, another feature that distinguishes lipedema fat tissue from regular fat tissue, is that it is resistant to diet and exercise. So when you go on whatever type of diet, a fat reducing diet, you change your diet, do lots of exercise, the rest of your body responds, your normal fat tissue responds. The lipedema fat tends to like ignore that. It doesn't respond the way other fat tissue does to diet and exercise. So I want to read some stuff. I have so much to say, but I'll start with one thing, and I'll put links to all of these papers down below also. You can read them if you want to, but this frustrating genetic disorder of fatty deposition is not particularly rare, but it is rarely diagnosed because clinicians fail to recognize it. Now, I'm going to kind of go along that line. There's another paper that says something about that, how much it's missed. Because the thing is, that said it's genetic, it does have a genetic component. It does tend to run in families, but it's not uncommon for a woman to be the only person in her family who has it. So if there is a genetic propensity for it, that's not the only thing that causes it. So a lot of women with lipedema do hear like, oh, the women in our family, we all just have big legs. Well, Yeah, because the family has lipedema. It's not just like we have big legs. Why do we have big legs? Oh, because we have a genetic propensity for this thing. So they're currently looking, they're trying to identify different candidate genes that seem to be associated with this, but no one knows for certain what causes it. I'll go into some speculation here in some of these papers, but we don't really know what the primary cause is, but it is almost exclusive to women. So it's probably a hormonal thing, especially because of the way the fat is deposited. We would kind of almost automatically associate this with an estrogen type of fat deposition. Men and women store fat in very different places under the influence of the female and male sex characteristic hormones. And then, what was I going to say? With the genetics and the cause. Oh, and it's triggered, nobody has lipedema at like 3 years old. It usually sort of gets triggered or develops at certain times of hormonal change. So in some women, it does kind of start developing after puberty. In some women, it's after pregnancy or childbirth. In some women, it comes on after menopause. So these periods in a woman's life of very radical hormonal change seem to be a time when it develops. So we can kind of assume clearly this is a hormonal thing. We just don't know what exactly is happening to trigger this. And there's 4 stages. I think there's 4. There might be 5, depending on the paper you cite. There's various stages of lipedema based on like the extremity and some of the symptoms that you have. And there's different types depending on what's affected. In some women, it's really just the hips and the buttocks. In some women, it's the hips and buttocks and thighs. Some of the women, it's the whole leg. If you're interested in this, you can just search online for images of lipedema, or all the papers have images, but depending on where you work, they may not be suitable for work. They're not dirty pictures. They're not people's private anatomy. It's legs, but it may be a little off-putting to some people. So brace yourself if you do decide to look at these pictures. But if based on what I've just described, you think you might have this, I encourage you to look, because you might have it. It is not uncommon to be undiagnosed for years and years and years. And I'm going to try to find the thing that I wanted to read to you about people being undiagnosed for years. Here it is. Lipedema is frequently misdiagnosed as lymphedema or chronic venous insufficiency, or patients are told they are just fat. Thus, many patients endure treatments that will not improve their condition, or blah, 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 blah. Coupled with the embarrassment of their condition, it is not surprising that the typical lipedema patient is demoralized. They've done a couple of surveys of women with lipedema about mental health and emotional health, and they do have higher rates of anxiety, higher rates of depression. There was a small study out of, I forget what country it was. I want to say Norway, but I could be wrong, where women with lipedema had higher rates of suicide compared to the general public. So it's really not, it's not just an aesthetic thing. I mean, like I said, it's painful fat. And in the later stages, you'll see if you look at some of the pictures, the legs can become so large that it really interferes with your mobility. And so that's huge for quality of life. If you can't even walk around very much, if you can't, do the activities you want to do, it's that can be a major factor in quality of life and emotional health. So it can be painful just to get around. You might be limited just because like anyone else, anyone that does have regular sort of obesity, if you can't fit into a booth or in an airplane seat or something, it's, that just hinders your ability to participate in life. And there's so much more. There was one, it might take a minute to find, but I mean, basically, if you're living with this, ladies, some of you may know that you have it, but if you don't know you have it, I mean, it's in here somewhere. You may have been shamed and blamed by a doctor. You may have been dismissed like, oh, you're just fat, you need to eat less and move more, or, you know, been subjected to like invasive procedures that are not going to help, that are not going to do anything. And there's one of the papers says something to that effect, but it's going to be hard for me to find it. I don't know. I guess what I want to say before I move on is that it's not just fat. It's not just like eat less, move more. This is not a calorie balance problem. I mean, if it was, then why is your doctor unable to explain why the fat is localized to that lower body area? Wouldn't you be fattening equally everywhere? And you're not. Lipedema has that very distinctive lower body distribution pattern. So what else can I say? One of the things that I'm learning, I mean, I've known about lipedema for a long time, but I just started learning more about it. One of the things that I've come across more recently in sort of researchers that are looking at, okay, like what is causing this? What is really going on here? They're looking at increased permeability of some of the capillaries, of some of the blood vessels in this fat tissue. They've found that a lot of women with lipedema also have hypermobility, like Ehlers-Danlos syndrome, if you've ever heard of just hypermobility of joints. And so that may have to do with excess laxity, or just sort of like, you know, increased permeability and laxicity of the blood vessels, meaning that they would be more permeable to letting fluid out into the fat tissue. Whereas like blood vessels are supposed to be selectively permeable, keeping in certain things and letting out, and kind of very balanced as to what they're letting in and out. And if they're letting out too much fluid and it's accumulating in that fat tissue, and that fat tissue is just expanding. So that's an interesting thing, that just some of these blood vessels may be more permeable. And yeah, these microvessel changes are especially intriguing, considering that hypermobile joints have been found in a high percentage of women with lipedema, suggesting a connective tissue disorder. Blood vessels are highly innervated, meaning innervated with innervation with nerve tissue. The dilated capillaries may alter sensory nerve function, and this might explain the pain experienced by lipedema patients. So there is something called lymphedema, which is different. Lymphedema can happen in women and men, and it happens for a lot of different reasons. Many people with cancer who have various lymph nodes removed from their body, or any kind of trauma, any kind of surgery that affects the lymph nodes, can lead to lymphedema, and there's other conditions. Lipedema is distinct from lymphedema, but they do overlap very frequently. So many women that have lipedema, especially in the later stages, the more severe stages, they have lipedema and lymphedema, and that's actually called lipolymphedema, because you lipedema and lymph, it's lipolymphedema. Let me pause here to look through these papers. I'm going to put, I'll link to these papers, but I'm also going to link to some resources for you. This video is not intended to be the end-all, be-all, exhaustive lipedema education. Like, there's other people that are experts in this who I'm going to point you toward if you want the full story from the experts. There's a lady named Catherine Seo, S-E-O, who, like search engine optimization, except she's Catherine Seo. She runs a group called the Lipedema Tribe, and she has lipedema, and she basically started this from the ground up with other affected women who had to advocate for themselves. And because there was nothing else for these patients. There was no support group, there was really nothing. And they've built a really, really lovely, supportive community where you can go for help and get resources. And they did a movie, they produced a movie called The Disease They Call Fat. And you can watch it on Amazon Prime. I think I'll put a link, but it's available for free on their Facebook page. So I'll put a link to that. I recommend watching it. It's about like a 55-minute movie, and it's about lipedema, and it includes the fact that so many women go so long undiagnosed. And it's, you know, when I was talking about the impact on quality of life and anxiety and depression, if you're living with lipedema, or maybe you have this and you don't know you had it, and maybe this is the first you're hearing about it, you might feel very, very stigmatized by other people who are judging you and looking at you, including medical professionals. You know, there's entire papers in the medical literature written about bias and prejudice and stigma against heavy people in healthcare. And it's really problematic when you have a medical condition through no fault of your own. Like you are not in control of lipedema. I mean, allow me to make that clear. Like when I say it's different from sort of garden variety obesity, lipedema is like not something that you woke up one day and said, I'm gonna deposit all my fat for no reason uncontrollably below my waist. Nobody does that. And so nevertheless, like there's so much stigma, and especially because I don't know if they don't teach this in medical school or what, but I guess a lot of doctors just don't know about this, or they don't recognize it because it's not, there's no blood test for it, right? There's no blood test, there's no diagnostic thing, like you can't take a biopsy, yep, you have lipedema. It's a differential diagnosis, meaning it's based on the clinician's judgment, on their experience, on their observations. So it's not something definitive. Like I said, there's no blood test, there's no genetic test that, you know, says for sure that you have it. It's based on what is the appearance of this? Does it hurt? Is it nodular? Do you have all these other things? There was a thing here that said something about the doctors. Why can't I find it now? Oh, and by the way, lipedema, it was first identified in 1940, or first formally written about in the medical literature in 1940. That was the first known medical paper about it, 1940. But here's what's interesting to me. It definitely wouldn't surprise me if there's some degree of genetic component at work, because if you think, you know, think if you've ever been to I want to say a natural history museum, or like an anthropology museum type of thing, where they're showing artifacts, and think of the little stone carvings of women from way back thousands of years ago. Don't they very often resemble what I've just described, like a lipedema fat deposition pattern? A woman, normal size head, normal size little torso, and very, very large hips. Because that was a sign of what? Fertility. So really interesting that this may have been revered in the past. This may have been celebrated and worshipped almost as a sign of fertility, as a sign of womanliness. So if this is a gene like that, it would have been passed down. But that's, I mean, total speculation on my part. I just find that really interesting, because I'm picturing like social studies textbooks that I had as a kid that would show pictures of those little stone figurines, and it looked exactly like some of these lipedema pictures I'm looking at in these papers. So, all right, what else can I tell you about lipedema? Something kind of interesting, but not all that surprising, is that women with lipedema tend to have lower rates of things like type 2 diabetes and hypertension and cardiovascular disease. And I say that this is not that surprising because of that gynoid fat deposition pattern. That fat below the waist, in the hips, in the thighs, in the lower body, is less metabolically problematic, so to speak, than the visceral fat, right? Than that android sort of apple stored around the middle. So these women do have lower rates of those metabolic problems. Now, I'm sure that is of very, very little comfort to you if you happen to be living with lipedema. You're like, whoop-de-friggin' do. Yay for me, I have a lower rate of type 2 diabetes. I mean, that's nothing to sneeze at, but there's this paper, it's called Lipedema, Friend and Foe. This paper is an insult, kind of. kind of an insult because they're talking about how, like, pros and cons of lipedema, right? And the pros, they're talking about low risk of diabetes despite higher BMI. Well, of course, right? We said you're heavy, you've got a lot of excess fat, but it's in the lower body. So you have a lower rate of lower risk of all the cardiometabolic illnesses associated with that visceral fat. Normal blood pressure despite obese BMI, lower risk of cardiovascular disease, normal lipid panel. Let's see. Yeah. Resistance of lipedema fat to loss by lifestyle changes. Lipedema fat resists loss by extreme dieting and or overexercise. They list this in the pros. They list this as a nice fun thing about lipedema, but they say, well, I correct. They list it as a faux, but, quote, this aspect of lipedema is a faux, but there may be an evolutionary benefit to a woman having lipedema fat. For example, in times of famine, women with lipedema could have retained fat, maintaining fertility and the ability to breastfeed their children, passing on their genes within the population. Isn't this exactly what I just said? Let's say you had lipedema a couple thousand years ago. When there was a famine, which women are going to be able to have a child and carry it to term and feed it? The women with lipedema. That's kind of a tangent, but I once read a long time ago that when you breastfeed, a lot of the fat that's in the milk comes from the hips and thighs. Like the fat that's in the breast milk, the fatty acid composition of the breast milk resembles the fatty acid composition of the fat that's stored there. So that's kind of a foe, but also a friend. This is obnoxious buoyancy. Lipedema fat offers dramatic buoyancy in water, making water activities enjoyable. So if you have lipedema, well, boo-hoo, but you can float really well. Isn't that fun? That's an insult. I can't believe that's even in here. Women who cannot... Now, I take that back. I will say that halfway. The other half is, if your mobility is limited, if you are in pain when you walk and you have trouble walking so you can't exercise, because separate from fat loss, exercise is good for health, then that actually might be a valid point if you want to do water aerobics or water activity. So, okay, I take that back. But women who cannot swim to the bottom of a swimming pool or scuba dive without a very heavy weight belt do not find this beneficial. So yeah, if you are really buoyant because you have lipedema and you can't scuba dive because you're so floaty, this is like, it's an insult. How did this even get published? Compassion is seen as a friend. Women with lipedema, recognizing the existence of persistent fat, have developed compassion for people who are overweight and obese and their struggles with weight loss. This compassion is important in our society that is rampant with fat bias. Yes, I agree 100%. Compassion is really important in our society that is so friggin' fat biased. But I think you can have compassion without having lipedema, and like that's, I think lipedema can be so debilitating in some ways that they're grasping at straws. They're desperately trying to point out anything that can be good about this. And if you have lipedema, I hope I'm not coming across as like, well, there's nothing good about it, but that's an insult. I just think you can be compassionate without having lipedema. Soft skin, they have a beautiful face. Women with lipedema state that they have fewer wrinkles and a more youthful face than women without lipedema. You'd probably prefer to just not have lipedema, right? And then, of course, the foes. Pain, gait abnormalities, and leg joint issues. Hypermobility, fatigue, psychosocial distress, impaired lymph flow, social isolation. Come on. That paper bugged me so much. I can't, maybe I should be less harsh, like they are pointing out some nice things about it, but gosh, man, oh man. Let me see what else I have here. So there are treatments. I mean, let me say there are treatments for it. Nothing can really make it go away, as far as we know. Some women do liposuction, where they will actually physically remove some of the fat from you surgically. I haven't looked at the papers on liposuction for lipedema, so I don't know if you have the lipedema fat removed that way, does it just come back? I mean, I would assume it does. If that's a hormonally mediated thing, I would assume it just comes back, but at least that liposuction probably buys you a few years maybe of improved mobility and decreased pain, like I would assume. Also, kind of like same as lymphedema, with lipedema, you can have compression garments and stockings that at least try to constrain it to some extent. Manual, I don't want to call it drainage, it's total decompression, where it's like, there's machines that can do it. There's like deep tissue massage kind of stuff where they can move things along. And I'm not a real expert in it. I shouldn't say too much about it. But those are kind of some of the treatments. So there are certain things that you can do. But there is a new paper out, or maybe it's not that new. When did this get published? November 2020. So it's a couple of months old, but not super old. Just end of last year. Called Ketogenic Diet as a Potential Intervention for Lipedema. And Catherine Seo is one of the authors, along with a lady named Leslyn Keith, who wrote a small book about keto for lymphatic disorders. But Leslyn Keith is very active in this community, as is Carol Rousmet, who is a thyroid expert. Don't get me started. She's one of my favorite people in thyroid. Anyway, it was a multi-author paper, and they had a conference, a virtual conference, last November. It was keto for lipedema and lymphedema, keto for fat and lymph disorders. And the conference is over, but you can purchase the recordings of the conference. And Dr. Westman spoke. I think Ben Bikman spoke. I think Robert Cywes spoke. I mean, a whole bunch of the really well-known keto people spoke, including, in addition to some of the women with lipedema telling their stories and sharing their tales and everything. And they're having another one kind of soon, I think in April or May. I'll put links to everything so you can explore to your heart's content. I'll make it very clear what's what, the old recordings versus the new conference. And so, yeah, so they know some of these women took it upon themselves to explore keto. And what they're finding is that even though the lipedema fat is typically resistant to loss through normal diet and exercise, keto seems to help significantly. Not like miraculous, magical, make your lipedema disappear, but it seems to be more effective than just about anything these women have tried. Really, really amazing success stories in that lipedema tribe community that I will link for you. And they speculate as to why. We know with keto, I've talked about this in previous videos and stuff, but so many papers have already been published about how keto does so many beneficial things for the body, totally unrelated to weight loss. So even if the lipedema fat still doesn't respond to decreasing, like even if the fat doesn't get smaller by keto, other things in the body might improve because of keto, including the pain, right? We know that keto is really good for inflammation, really good for joint pain, really good for sort of muscle pain, like all kinds of just things, aches and pains that people have tend to get better on keto. And that seems to be true of lipedema. The pain seems to improve a bit long before they've lost a lot of weight. That's something they note in the paper on keto for lipedema, that several people have reported improvements in the pain before they've lost any weight. And they also, so they're going to speculate here. Several possible explanations exist for why ketogenic diets appear to permit adipose tissue loss in lipedema while conventional diets do not. Lipedema adipocytes, adipocyte is the fancy word for fat cell. Lipedema adipocytes may require much lower levels of insulin than other adipose cells for lipolysis to occur. lipolysis meaning the breakdown of fat. So let's say maybe a normal fat cell, like a regular fat cell, just, like diet and exercise, okay, it gets smaller. A lipedema fat cell might need to really get that message loud. It might need to have an especially low level of insulin that most people, or some people at least, will only achieve through a really low carb intake. And I have had the privilege of meeting Catherine Cywes, at least virtually. We've spoken on Zoom, and Leslin, and some of their other, their cadre, I guess. They have a dietitian that works with them. I think she's from Australia. Megan Pfeffer, maybe it's Morgan, Megan Pfeffer. And so they know, they have a lot of women doing keto, and they just, but they have to be really, really strict. They know that they can't mess around. So not only do they have to do keto, like 20 total grams or fewer, some of them really only start to see things when they go carnivore, like no carbs at all. Some of them have found that any kind of sweet anything, sugar, alcohols, even the things that I'm always saying are totally fine, like saccharin and Splenda and the artificial sweeteners, even those, apparently some of these women really only do very well when all of that's gone. And sometimes with fasting too, which, fasting is a double-edged sword. I have misgivings about fasting, but it's always context dependent. If it's really, really helping, if regular keto, super strict keto is still not getting because there's this really severe condition, fasting might be indicated. And, we would hope that you do it in a supervised, safe way. We don't want you to stop eating for 5 days and not, be working with somebody to monitor you and be safe. But I'm just saying that these women have discovered for themselves that just sort of regular old out of the box keto is not enough for them. They really have to be strict all the time. They cannot get away with some of the stuff that maybe the rest of us do. Some of them have to fast, or they find that they really, really do best with carnivore, just all that kind of stuff. Some of them do best with no dairy. It's just all very targeted to the person. But how encouraging to know that some of them are having success with this, whereas really there's not a whole lot out there to help people with lipedema. There are those treatments, there are some of these mechanical and surgical treatments. It's not that there's nothing, but how nice if keto can give these people a bit of a reprieve from some of this. And we need much, much more research. And even they even say this in their paper. They say, the paper is basically speculation. I mean, they're going off a lot of data in other conditions and mechanisms. Like, okay, keto does this and this and this at the cellular level. For that reason, it might or it should be helpful in lipedema. Now let's study it. Now let's get some clinical trials going. Right? The purpose of this paper is to encourage research into patients with lipedema in these 7 areas, and to specifically encourage research that examines the potential therapeutic impact of adopting a ketogenic diet in this patient population. All right, coming up on 38.5 minutes. Let me look through the papers and make sure I haven't missed anything critical, but I hope that this has opened your eyes to something that if you have lipedema, I really hope, and you weren't aware of that Lipedema Tribe community or that movie, The Disease They Call Fat, I hope that helps you see that you're not alone. This is much more common than we ever really thought. And if your doctor doesn't know about it, find someone who does. It is a thing. It's a real condition. It's not all in your head. You aren't imagining that your lower body is much larger than your upper body. And let's see, what else? Watch the movie and send it. If you have friends or family that you think have this, send it to them so they can realize, oh, this is a thing. I thought I was alone. I didn't know what to do. My doctor won't help. My doctor just says I'm fat and I just have big legs. Or, just to, I don't know. I hope this was educational in some way, but There are people who know way more about this than I do, so like I said, I will put all those links in the resources for you. But yeah, lipedema is described as adiposis dolorosa, or painful fat. First described in 1940. Yeah. I knew there was something that I wanted to read to you. Far too often, the women who suffer from lipedema are told that their leg growth and swelling is a result of their inability to control their diet or of their sedentary lifestyles. As if to suggest acceptance, they are often told that the women in their families just have big legs. As their disease progresses and they return to their physicians with an increasing leg swelling and weight, patients with lipedema are frequently questioned about their compliance with diet and exercise recommendations. As a result of a fixation on their increasing weight and growing body habitus, coupled with the fat shaming which runs rampant in society today, women with lipedema frequently suffer from significant psychosocial distress, including anxiety, depression, eating disorders, and isolation. One of the most common misconceptions about patients with lipedema is that they suffer instead from lifestyle or diet-induced obesity. Although some patients with lipedema may also have obesity, and although the obesity may influence the lipedema subcutaneous adipose tissue, lipedema is a mutually exclusive diagnosis and should be considered as such. I mean, and this was written by 2 medical doctors. At least there are medical doctors out there who get it. I can't imagine living with this condition and going to a doctor for help, going to a professional who's been to 1,000,000 years of school for the purpose of helping you, and being denied and being shamed and being insulted. I cannot even, my heart just goes out to you if you have been in that situation. Let me see if there's anything I'm missing. Exclusively in women, different types, the pathology, lymphatic drainage. Yeah, I guess I will take back what I said about them claiming the buoyancy of you like floating in a pool, because it does say, although lipedema fat is resistant to lifestyle modifications, there is evidence to support the positive effects of exercise, particularly aquatic therapy and lifestyle change on lymphedema, lymph flow, blah, blah, blah. So yeah, I can see that. If, I could see if you have lipedema, probably really hard to go for a run, and it may even be really hard to find a bicycle that's suitable for you. So if aqua activity, pool activity is okay, great. I take back what I said. And in fact, one of the authors of that paper, the friend or foe paper, is one of the same authors as the good paper I was just reading from. So I don't know what to make of that, but I think, I will just read you one last paragraph and then I'll sign off. Lipedema represents a common medical condition with many misconceptions. It is rarely taught in medical school and/or residency training, and as a result of this educational gap, a large population of patients suffering from this condition are forced to endure a plethora of unnecessary consultations, laboratory and radiological studies, and the psychosocial distress of being told it is their fault. With an incidence that may affect nearly 1 in 9 adult women, and I said other papers say 10 or 11%, it is important to generate appropriate awareness, conduct additional research, and identify better diagnostic and treatment modalities so these women can obtain the care that they need and deserve. Mic drop, paper drop. Except I can't take credit for that. This paper has to take credit for that. Yes. The care that you deserve as a human being with a medical condition that you have no control over. So if you have lipedema and you thought you were alone and you didn't know that there was a whole community of people that understood and that could relate to you and that could maybe point you toward help in your local area possibly, there are resources for you. Check them out below. If you have a very, very disproportionate lower body and you didn't know that maybe this is a medical condition that you have, check out lipedema. You might have lipedema. I don't know. I'm not a doctor. I can't diagnose anybody, but check it out. And that's it. I really hope this was helpful. And I'm okay with having a 45-minute video if it's going to be something that I really feel might be helpful and educational for people. So that's it. I will see you next time. And remember, patreon.com/2itnutrition. What else can I tell you? That's about it. I'm the author of 3 books. Links to all of them in the notes. See ya.